leadership is extremely important to analytic success. Without leadership, you don't have the right foundation to lay all the people, the processes, and the data on top of that. What's happening in healthcare is, people are in such a rush to implement analytics that they're forgetting the basics that they have to do. And without doing that, they're doomed to fail. You have to recognize that leadership is not a skill. Leadership is a process that must be practiced every day. When I talk to the executives from the healthcare organizations and other business organizations, they don't think of it as a skill. It's not a communication skill. It's not a visionary skill. It's a process. And they think about what they're going to do every day. You think about it before your meetings. You think about it after your meetings, and it's called reflection. And then you have some coaching and mentoring. You're working with someone who works with you to understand, what did I do? What could I have done better? And so forth. And that's why I call it professional leadership. Professional leadership process has 5 steps to it. Okay. And it's also with assessing your leadership skills, your leadership abilities, visioning how you're going to apply those abilities, executing on that. Then you go to reflection and then coaching and mentoring. And then once you finish the coaching and mentoring, then you go back and start saying, how did I do before, and what should I do to improve on that and to change that in the future? Situational model has 3 parts to it, and I call it the influences framework. You have the leader, you have the followers, and you have the environment. The leader is the person or the company or whoever it is. Followers can be anyone. In healthcare, the followers can be the physicians, the nurses, the staff. It could even be some of the patients, to be honest with you. And the environment is you have your government regulations, your professional regulations, and you also have the rate of change in the situation in the environment. And those 3 things have to be in equilibrium for you to be a successful leader. When they get out of equilibrium, the leader has to adapt to either grow his or her leadership or detract from it if they're overpowering people. The first piece of advice for someone to become a better leader is, 1, to understand it's a process. It's not a skill, and to understand what the process is and how to and apply that on a regular basis. 2, to become a really good leader, you do the basics, but then you have to incorporate the reflection part of it. And reflection meaning I understand when I have meetings coming up today, what do I need to think about? What's going to happen. I know when I'm in a situation, I have a meeting coming up, maybe a difficult meeting sometimes, I will run scenarios in my head to see what's going to happen. Who's going to say what, what may happen and so forth, so I can be prepared for it. I call that pre-reflection. And then post-reflection is, how did I do in that meeting? Did I change someone's mind? Did I come off as gruff or something like that? Those are things that are important. And then the coaching and mentoring is important, and you have to find yourself a good coach or a mentor. It could be informal, it could be informally, but you have to have someone who you can bounce ideas off of. Say, hey, you know what? I had this situation happen the other day. This is how I handled it. You have any suggestions how I could have done that differently? They may say, well, you did a good job, or you could have done something differently here, or you did that, but you could have also done this also. Healthcare analytics is a challenge because a lot of the people who are running the healthcare organizations don't have the business experience to implement analytics. Typically in any industry I've worked in, you have to make sure that the people at the top understand what analytics can do for you, how to implement it, and get the value out of it. Well, you have mostly in healthcare, which is, we have a lot of physicians who are in leadership positions, which is not a bad thing. I think, we need to have physicians in leadership, but they have to have a broad business experience. So what a lot of healthcare organizations are doing is either the physician leader is getting more training outside of there, getting business training, whatever, or they're hiring a chief operating officer who has business experience. Then that person, takes care of those business functions, and the CEO can be focused on the medical part of it.